Meanwhile, some of the COVID patients in India are also suffering from a potentially deadly black fungus infection. Local media say over 7,200 cases of black fungus have been found across the country. The disease, which is called mu-cor-my-cosis and has a high mortality rate, is affecting increasing numbers of the country's COVID patients. It can cause blurred or double vision, chest pain and breathing difficulties. Doctors have often been removing an eye or part of the jaw trying to stop it spreading. Indian Prime Minister Narendra Modi said the country had to take precautions and prepare to deal with it. Now, for more insights into the situation in India, let's cross live to Dr. Alice Huang-Kyun-Tan in Seattle. Dr. Tan, let's start with this disease called black fungus or mu-cor-my-cosis. How dangerous it is and how closely it is linked to COVID-19 or the treatment or the environment that's treating COVID patients?
So mu-cor-my-cosis is a very rare but very dangerous disease with a high mortality of about 50%. The range is between 40 and 80% depending on the location of infection and the underlying condition of the patient. In terms of infection, as you mentioned, the fungus can infect any part of the body, but the face is frequently infected, and it can infect the eyes, nose, and sinuses. And once it affects the soft tissue and skin, it can start to eat away and destroy the bone. And from the bone, it can start to infect the brain. It's a very difficult disease to diagnose, and oftentimes patients will have progressed for several days before coming to a doctor to get the diagnosis. The relationship between mu-cor-my-cosis and COVID-19 is as yet unknown. However, there are many risk factors involved. First of all, diabetes is a well-known risk factor for mu-cor-my-cosis, and up to 10% of adults in India have diabetes. It's thought that many more adults have undiagnosed diabetes. Also, the treatment with steroids. Steroids can be a life-saving treatment for COVID-19 patients, but steroid treatment is also a known risk factor for mu-cor-my-cosis because it causes immunosuppression. COVID-19 also, as a disease, causes irregularities in the immune system. It can also cause blood sugars to get out of control. So it's really a perfect storm in terms of both the disease and the treatment of the disease. They can all lead to a high risk for mu-cor-my-cosis.
Well, Doctor, you just described the situation in India now as a perfect storm, but as an expert, have you seen any way out of it, even a possible path?
Right. Well, so it's a horrible tragedy that's happening within a crisis. One thing that I did notice is that the recommended dose for steroids as a treatment for COVID-19 among patients in India, that dose, they allow a dose that's higher than the dose that's recommended by the WHO, which is 6 milligrams of dexamethasone once a day. And so I would urge any doctor who's treating a diabetic COVID-19 patient to stick to the WHO's limit for steroids in the treatment of COVID-19 patients. Otherwise, really, these patients are at the highest risk of death if they have COVID-19 and mu-cor-my-cosis, and so they must be prioritized in terms of access to a hospital bed, immediate surgical treatment, and IV antifungal medication.